The war's largest battle, it differed from every other on this continent in its scale and ferocity. On July 1, 1863, two massive armies collided in the fields, orchards, and forests near Gettysburg. They fought for 3 days with full force and no mercy given. This immense engagement is considered the turning point in the great struggle that sits at the heart of American history. The bloodiest chapter of a fratricidal war, the battle was also an epic slaughter. Nearly 30% of the total troops that fought at Gettysburg were killed. Roughly 28% of the men in George Gordon Meade's Army of the Potomac and more than 37% in Robert E. Lee's Army of Northern Virginia perished in the fighting. An estimated 64,000 soldiers from both the Union and Confederate armies were killed, wounded, or listed as missing by the time the Gettysburg invasion into Pennsylvania concluded. Severed limbs were piled in mounds and buried together at field hospitals near Gettysburg. The wife of the town's biggest 111 cemetery owner, Elizabeth Thorne, was said to have dug more than 100 graves personally while expecting a child. The dead were collected from various locations on the battlefield and buried near the spot where they died. One of the bodies found on Cemetery Ridge was that of a woman who had fought for the Confederacy while concealing her sex. It is reported that during the charge up Cemetery Ridge, another disguised Southern woman lost her leg. This town, along with the 8 to 10 miles of surrounding land, is essentially one vast overcrowded hospital. Every usable space in the town has been freely given to the casualties by the residents. The men were in a terrible condition. Many of them had nothing beneath them as they lay on the damp earth. There was an unusually high number of amputations conducted in this hospital, with the amputated limbs lying directly on the ground. Most of the soldiers, if not all, were without clothing. There was nothing appropriate to eat. The doctors were overwhelmed, without garments, a large number of them nearly entirely naked and filthy. They were left in the mud, shrieking, weeping, and begging their comrades or visitors to ease their suffering. They were also without shelter. If it had not been for the tremendous efforts made to avert it, some individuals would have drowned yesterday during a violent thunderstorm that brought powerful winds and torrential rain. Both Union and Confederate soldiers suffered from the deadly combination of 19th century military medicine and explosive artillery shells and soft lead Minié balls. Over 2/3 of the gunshot wounds affected the leg or arm. The exit wound for most projectile injuries was generally much larger than the entry point. Larger wounds could result from ricocheting or deformed bullets, which could also introduce foreign materials into the wound. The extensive tissue damage caused by the Minié ball, along with its tendency to contaminate the wound, caused a sharp rise in the onset of infection. A bullet struck my right arm and passed through it as we advanced. A shell exploded as we charged into the wheat field, killing 2 of my comrades and shattering my right leg. After being shot in the arm, I felt a numbness similar to being hit on the funny bone. I immediately turned to my fellow soldier and demanded to know why he had struck me. My leg shattered and I collapsed. I lay there dazed for a few moments before understanding that the enemy troops were closing in around me. Memories of Private Jacob Henry Cole, 57th New York. The wound was typically treated conservatively, with intervention restricted to the extraction of the projectile, foreign bodies, and bone fragments if the injury caused minimal damage to the bone. However, Civil War surgeons quickly learned that amputation was the most effective treatment if the bone was shattered. Despite losing the limb, the soldier was saved from potentially fatal complications like blood poisoning, gangrene, bone infection, and a potentially deadly streptococcus infection. Resections, or the removal of a section of shattered bone, were also performed, but these procedures had higher overall mortality rates than amputations and conservative treatments combined. Amputations were often performed by surgeons throughout the night, as frequently as every 10 minutes. Minor injuries were treated with lint packing, a moist bandage, and removal of any foreign objects if time permitted. Injuries to the head, neck, chest, and abdomen received the least attention, if any, at all. Most of these patients were given pain medication and left to die because there was little that Civil War doctors could do to save them. I was shot in my left arm in a skirmish that took place Friday afternoon near Gettysburg. A musket ball shattered it above the elbow. When I reached this hospital on Saturday the 4th, my arm was amputated that afternoon by highly skilled surgeons. It was taken off in its middle third, which of course leaves only 6 inches. Although I was under chloroform, I was unaware of the operation's proceedings, and the subsequent days were quite painful. Nonetheless, I believe my recovery is progressing well. Sergeant Alexander Blake, 1st Missouri. In close quarters combat, many soldiers were also struck or shot directly in the face. Private Joseph Harvey's injury, however, caused by a shell fragment rather than a bullet, serves as an example of a typical facial wound. It felt as if a floodgate in my neck had opened, releasing a downpour of blood. It seemed like I had a chicken bone in my mouth, something loosely sitting in my left cheek. In reality, it was a piece of my jawbone that was loose in my mouth after breaking away, teeth included. The soldier was taken prisoner by the enemy and held for a duration of 11 days. He was admitted to Alexandria's Mansion House Hospital in mid-July 1863. Pieces of the dead bone were extracted in August. Liquids and saliva leaked from the cheek because the tissue loss there had not yet been reconstructed. On the right side, there was some facial paralysis and slight hearing loss. This soldier was granted a pension, and on December 9, 1868, it was reported that he had died from an unknown cause. The rudiments of plastic surgery saved some soldiers, but in most instances, being struck in the face by a shell fragment or bullet meant a virtually certain death. At Gettysburg, Private Rowland of the 4th New York Heavy Artillery was hit by a shell fragment that obliterated the lower jawbone and soft tissues, destroying the base of the mouth and causing the tongue to protrude and dangle on the neck, making swallowing and speech impossible. He effectively received a new face or a fresh chance at a normal life after the operation. In that era, disease was a soldier's biggest fear rather than the battlefield. In crowded camp conditions, soldiers were susceptible to infectious diseases that spread rapidly. Indeed, more men died from diarrheal diseases, smallpox, malaria, and yellow fever than from injuries sustained in battle. Some men fell so ill they required hospitalization immediately. Some never even reached the fighting. By the war's conclusion, sickness or infection had killed 2/3 of all Union and Confederate troops. Hospital or battlefield gangrene was one of the most lethal ailments early in the war among those with battlefield wounds. It's important to remember that surgeons practicing during the American Civil War had no knowledge of germ theory. Many frequently did not clean their hands between patients. There was no sterilization of surgical tools, and there was a misconception about wound discharge that proved detrimental to many soldiers. Infection was extremely common at the time, and patient recovery was often a matter of chance. Patients suffering from hospital gangrene typically have decaying flesh and a pungent odor. The skin would begin to deteriorate rapidly as the wound margins turned gray. The patient endured excruciating pain, and the sight was often difficult to bear. There were constant attempts to combat the infection, but many surgeons were ignorant of the cause of hospital gangrene. Ventilation was one of the most common methods used to eliminate the infection. However, sometimes if these windows were near sources of bacteria, such as sewers or areas of human waste, incidents of hospital gangrene rose. Gettysburg was not just the war's bloodiest battle, but it also saw the highest number of generals killed in action. Generals Semmes, Barksdale, Armistead, Garnett, and Pender, along with Pettigrew during the retreat from the Confederate side. Generals Reynolds, Zook, Weed, and Farnsworth, as well as Vincent, who was promoted posthumously from the Union side. There had never been so many general officers engaged in a single battle. Among the wounded Confederate generals were Major General John Bell Hood, who was shot in the arm and lost the use of his left arm, and Major General Henry Heth, who was shot in the head on the battle's first day, but survived miraculously without sustaining any permanent damage, partly due to his hat being stuffed with paper dispatches. It is likely that wounded soldiers experienced psychological problems, including PTSD, previously called homesickness or nostalgia. The opiates, morphine, laudanum, and other compounds administered to them for pain relief caused an unknown number to develop an addiction. According to current research, opiate addiction was more common in women who took the drugs for so-called feminine ailments. Some wounded soldiers struggled with feelings of diminished masculinity due to their inability to provide for their families. These were very real difficulties, as documented by numerous modern historians, along with the inquisitive or disapproving reactions of townspeople to these maimed soldiers. Beyond the human carnage, approximately 5,000 horses and mules perished in the battle. They also had to be gathered and burned in huge piles, creating a stench that lingered over the region for weeks. Local residents became violently ill from the smell. Don't forget to subscribe and press like.